Hello, my name is Tony Young. I'm the National Clinical Lead for Innovation here at NHS England. I really wanted to be with you at the conference today because I'm really passionate about healthcare and wellness right across the life science industry, but because of pre-existing commitments I couldn't be with you today. But you do have two of our entrepreneurs from NHS England joining you today, and so you will hear firsthand of some of our frontline clinicians on how they're helping transform healthcare. But what I wanted to do was tell you a little bit about the work we're doing here at NHS England, how we're looking at innovation in healthcare, and now how we've moved on to entrepreneurship and how that's unlocking new opportunities for some of the challenges we face. So traditionally in the NHS, we've supported people who wanted to be leaders or academics or teachers, but if you wanted to be an entrepreneur in healthcare, that hasn't been something until recently that the system has supported. So when I was appointed here 5 years ago, initially as the National Clinical Director for Innovation at NHS England, but now the National Clinical Lead, I was approached by some of our frontline staff saying, we've got a great idea for a startup that will really transform patient care, but we're being told that we can't do a healthcare startup and our medical training at the same time. And so many doctors were leaving. In fact, 5% of doctors per year are permanently leaving healthcare, and at the end of our foundation years, about 56-60% of doctors are taking a break and travelling abroad, going to do something else, and many of them are not coming back. So what could we do to encourage some of our brightest talent that we were losing to stay in healthcare? So 3 years ago we launched the NHS England and Health Education England Clinical Entrepreneur Programme. The vision was that we would equip our frontline staff with skills, knowledge and experience from the commercial and startup sector, bring that to bear, so a workforce development programme that will give them that knowledge to help them address some of the grand challenges we face in healthcare through either being an entrepreneur and setting up a business, a social enterprise, a charitable enterprise, or by being an intrapreneur, so someone who worked within the organisation to try and help bring that commercial knowledge to change it. Well, we've now just finished year 3 and we're about to start year 4, and we've had over 500 entrepreneurs now on our programme. So our stats for the end of year 3, we've gone from a standing start to now the world's largest workforce development programme in healthcare. In our first 3 years we had over 360 frontline clinicians. Now that's not just doctors, it's dentists, allied health practitioners, clinical scientists, pharmacists. So we've welcomed the whole range of people who provide clinical care onto the programme. So over 360 of them, between them, there were 175 startups. They raised over £164 million in funding, mostly from the private sector. They've impacted over 17 million patients and professionals that we can count. They've had over 500 million impressions on social media, which is just amazing. But one of the things I'm most proud of is I think it's 106 clinicians, junior doctors and others who left the health service have come back to work in it as a result of this programme. So we have turned a brain drain into a brain gain for the health service. And all we've done is given people permission to be entrepreneurs within healthcare. Now there have been some amazing startups, from back office things, helping us sort out how we book locum shifts, how we book outpatient appointments and such things, to virtual holographic avatars that pop up and give you medical advice in a remote war zone, for example. And we've had that working in Syria. We've been training remotely across the planet plastic surgeons in Peru with plastic surgeons from the Royal Free Hospital in London, helping train and upskill them. We've lots of AI things going on. The NHS has just launched its AI lab, £250 million of funding. One of the startups on our programme has launched the AI patient. Actually, we know lots of people are trying to type your symptoms in, and the artificial intelligence will help you on your pathway for triaging you and suggesting what's going on. But actually this junior doctor was a medical student when he started, and he decided actually we need the patient actually, so I can tell you ask you what's wrong with you and you can tell me the symptoms. And it's really quite stunning and a bit disconcerting to see this thing understanding what I've said and then talking back to me with real symptoms real time. So technology has really changed and transformed everything, and if we expect our great universities or hospitals or the centre of government to come up with the ideas that are going to change healthcare, I think we're going to be waiting a long time and we won't necessarily get all the answers. But by looking at the entrepreneurial and the startup world, including them, but not just working with frontline staff, including patients as well, bringing them to the heart of the healthcare system as we redesign it, then we're going to be looking at bringing new thinking, new action into healthcare. So we've been working with colleagues from the Royal College to look at how we might make some of our entrepreneurial training, the lessons we've been learning in the NHS, available not just in human healthcare but in veterinary healthcare as well. And we're exploring, for example, postgraduate certificates in education with a number of university providers that could be accredited to see how, not just so we can include vets, but actually other industries too, because we realise that we need to bring everyone to the centre of healthcare if we're going to bring all the thinking we need to try and impact the grand challenges we face. So I hope you have a great conference, and you're going to have 2 fantastic talks from some of our entrepreneurs now, and I hope they'll be able to answer any of your questions. But if you Google NHS England Clinical Entrepreneur Programme, you'll see our website and all the great things we're doing on that. And I hope in the very near future we'll be working in partnership with veterinary medicine to try and bring some of those latest, greatest ideas that are there from veterinary medicine to the benefit not just of animal health, but potentially for human health too. Have a great conference.
It was about June 2016. I received an email from NHS England. And this email read something like, if you have an idea, an innovation that will help the quality of the service we give to patients or the quality of your work colleagues' lives, we want to know about it. So I'd been a junior doctor for about a year by this point and worked in an environment of fax machines and bleeps. I wasn't short of ideas. Okay? So I set to completing this application, but I soon realized that it wasn't going to be any normal application because one of the things I had to do was record a 1-minute video pitch. Hi, my name is Mark Martin. I'm an NHS Clinical Entrepreneur Fellow and the founder of SetPoints Health. And our innovation is a metabolic urine test. A urine test that allows an individual to learn how their body responds to diet, exercise, and medication. This is one of my favorite pictures because it captures a dog's most valuable asset, its sense of smell. So sensitive, in fact, that dogs are now being used to sniff out cancer. So meet the medical detection dogs. This is a charity based in Milton Keynes, and these dogs have been used to sniff out cancer because they can tell from a smell of a urine sample people who have prostate cancer from individuals who are disease-free. Now, this was very fascinating when I learned this, and it was very inspirational to the journey I took over the next 2 years in developing my idea and innovation to tackle metabolic disease. And this is where being a clinical entrepreneur became really helpful because it gives you a badge of credibility. So when you do approach people, they listen to you. It's good. It's kind of like a pre-validation. They listen to your ideas, which is one of the key strengths in this program that we're on. So over the last 2 years, we've been working on this project that we completed at the Montfort University in Leicester. And essentially, we set out to find some data because we live in a world that's very data-driven. So we had to look at a way of developing data to give to people to design a metabolic disease prevention program. So Magritech, you can see them on the top right-hand side of the screen, were instrumental partners in making this possible. And what we did is we learned that using their instrument, which is essentially, the best way to explain it is it's a benchtop MRI scanner, about the size of a microwave. And we learned that by running a urine sample in a test tube, we could tell the difference between someone with diabetes to a healthy individual. So now we had data. What do we do with this data? We had to look a bit more at how can we develop this into a program whereby we can actually help people day-to-day in the clinical practice. So we did a bit of research and we found out that diabetes can be detected many, many years before sugar levels rise by looking at very specific amino acids and metabolites in urine. So this is what we set out to, in the end, publish a paper on. Because ultimately what we wanted to do is be able to help people who want to eat well, be more active, detox, and essentially prevent metabolic diseases such as diabetes, we wanted to give them the tools and inspiration and empower them to do so, because that is in the NHS's long-term view, is very important. And the major challenge the NHS has today is keeping people who are living longer healthier for longer. So, as has been mentioned many times before today, medicine is moving closer to the home. And that's very important, especially when you're dealing with chronic disease. It's all about self-management and empowerment of patients. So we developed a home test kit, a direct-to-consumer test kit to see what engagement was, and also to test who our customer, who our user is going to be. We highlighted 4 main target markets. As Tony alluded to, the NHS doesn't have money to experiment with startups, understandably. It's public money. So a lot of money is raised in the private sector, so we had to be very broad in terms of where we look for funding. Ultimately, with an NHS background, we want to develop a test that can measure metabolic syndrome, okay? And that's a combination of diseases. But we have to look at other industries that we can disrupt. Pharma is one of them. How disruptive would we be in an industry such as pharma if you could tell what effect your medication was having on you? Is it beneficial or not? How disruptive could that be? How disruptive could it be in drug development? We also have keeping a keen eye open for health insurance. And obviously, with the right GDPR approvals, if you had a metabolic reading that showed you were actually 10 years younger metabolically than you were chronologically in your age, would you use that information to get a cheaper health insurance? I know I would. From the testing, what we learned that the best way to enter this market was through health and wellness, because the top 3, you need a significant amount of data to enter this kind of market. With NHS, you're going to need to do randomized controlled trials. So that's the stage we're at now. We are working with health clubs to develop the tools to inspire, innovate, intrigue people who are actively exercising and eating well on body transformation journeys, to give them an insight into what being healthy is like and how their nutrition and diet is affecting them. And so far, the response has been very good. And this goes well with my day-to-day job, which is a GP trainee here in Manchester. But something very interesting happened to me in the last month. First of all, I was invited to give this talk, which I'm very thankful of. But also, in the same week, a friend of mine who is here with us in the audience, Evelina, next to Zainab, part of my team, she asked me a question. She said, she works in a stable, and they have horses. And she said, we have a sick horse, and the vet is coming out soon to collect some blood and urine samples. And you know, I run my mouth off all the time about how amazing my urine study is. She said, well, could you help us? And I said, yes, I'm very interested, although I do have limitations. I'm just a doctor with human beings. So my invitation to people in the audience is anyone who is interested in innovation, in being an entrepreneur, to take my email address, get in touch with me, find me outside afterwards in the networking, because I'm all ears, and I'm very interested to collaborate with you lot. As Tony Young said, healthcare spans throughout the life sciences. Thank you for your time.
So I'm Tom Oakley. I am a radiologist by background, and I actually joined the program right at the beginning, so when there were actually just 100 of us, and 3 years ago. Since then, I've become the CEO of a public limited company that is floated on London Stock Exchange. I've raised £2 million and employed 12 people to build this product. Being a radiologist, my biggest problem with the healthcare system was that we couldn't share medical images very easily. And I can't talk to my clinical colleagues who are on the shop floor. If you're having a stroke, even in the centre of London, and you have to go down the road to another hospital for thrombectomy, it can take up to 3 hours for us to exchange your images from the hospital you were at to the hospital you're going to. And I just said, well, that's ridiculous in this day and age. So we created Bleeper. Bleeper is basically a PACS system on your phone. You can access any medical image, MRI, CT, plain film studies, even fluoro, from wherever you are in the world. And I can tell you that because I actually did this on Dartmoor. I reported an MRI from a walk in Dartmoor. We've also not just made it about transferring imaging, but also about allowing clinical communication. So this has a chat feature through an instant messaging. I can highlight something of interest on a scan and ask a clinical colleague a question about it. What is this? What should I do about it? We've even started to explore whether patients might want to have access to their own medical imaging. And we can make this available to a patient so they can walk out of a hospital with their scans. Quite useful if you're overseas and suddenly actually you get taken ill and your CTs from the UK can be seen by a clinician in the States. And when Tony asked me to come and have a chat here, he thought there might be some sort of overlap with veterinary services. So I wanted to ask you guys, how does imaging work in your sector? It's not an area I'm familiar with. I don't know how much of it is CT, how much of it is plain film. Who's happy with the imaging services that they have? Oh. Who would actually benefit from being able to share medical imaging? Okay. What kind of imaging do you use? CT? CT, MRI, okay. And do you report it yourself, or do you send it to a specialist? Okay, so a bit of a mix, okay. Do you think that your customers would want the imaging of their pets? Okay, that's good. Okay.
I think we should ask the question slightly differently. Should we report other because that's a different question altogether.
Yes, okay. Did everyone hear that? So the question was, should you report your own imaging? Or should you have a specialist do it for you? I don't know if there's an easy answer to that. Yes?
Well, it depends what it is. There is some stuff that we obviously do at university, so we can recognise, and it's all on, the more you do, the better you become, isn't it? So it depends. I think a GP can do some stuff.
I did once actually report a CT scan on a gorilla from Bristol Zoo. Just came into our hospital down in Torbay, which was quite an interesting case. So I agree with you, and imaging is getting progressively more specialised. And certainly I think that within the NHS, we couldn't run a system if everyone was having to report their own things. And off the back of that, we are looking at incorporating a lot of the AI imaging tools into this platform, so that if you're not a specialist, you can deploy an appropriate AI tool at the point you come to interpret the study, while you're still waiting for a specialist to give you an opinion, probably in about 2 to 3 weeks' time. So it should help you to feel more comfortable with imaging that you're doing. Sorry, a question on that.
I think just, so you asked the question earlier about imaging and what we use. I think cards on the table actually for the vast majority of first opinion practitioners, which is the main part of the profession. We don't have access to CT and MRI, certainly on site. So the vast majority of the first line imaging we would do would be radiography. And it is then a case of saying, actually, that's the first conversation that you have with the owners. And frankly, there's a large proportion of them that simply can't afford that next step up for referral to CT and MRI, those that aren't insured, for sure. So I think that's something that I know certainly as a sort of 10, 11-year qualified first opinion GP, I look at x-rays more and more frequently and have less and less knowledge as to what I've been looking at, other than that's obviously wrong, and invariably having that option to send it to a third party, to even if it is just to go, yes, you're right, or no, you're a complete moron.
Right.
I think having that sort of almost hand-holding service could prove vital, especially as we're losing a lot of more experienced clinicians.
Yes.
And there is sort of more of a younger, less experienced veterinary population across the profession as well.
Do you have problems with indemnity? Do you guys get sued a lot? No. Oh, God, that's good. How did you get off that?
Just to follow up, there's a global shortage of veterinary radiologists.
Yeah.
There's a global shortage of veterinary radiology residencies to try and catch up. And a consolidation of veterinary radiologists in reporting companies, of which there are several globally, who are hoovering up all the experts who want to work from home, not in clinic. So this kind of technology is coming to us, whether it's as mobile phone friendly, whether it's getting to be AI driven.
Yeah.
That's the regulatory sandbox issue that comes up by saying if a third party vet in a non-RCVS regulated environment reports on a UK case and an issue arises, where does indemnity and coverage lie? So that is a live sandbox issue that we perhaps should be thinking about now.
Yeah, the tech's the easy bit, right? There's all bits that go around it. With my other hat on, using the same product that powers this, we actually run sandboxes for testing and regulating AI, and we're evaluating some of that with NICE and MHRA. So we will build a sandbox of 10,000 CTs, deploy VAI tool into it, and we will see what the outcome is compared to radiology reports. So you actually get some real-world analysis of these sorts of tools. But liability is an interesting one, and that's something I think that will have to be worked out as these things go. So that's been really useful for me to understand, and I similarly be very keen to talk to anyone after this. I think we've got a breakout session just now. I mean, some of the thoughts I've had initially about this is, firstly, allowing you to share images much more flexibly between yourselves and specialists, also being able to make the imaging available to your customers, perhaps as a pay-for service, and also, as you said, actually building a specialist cohort of reporting radiologists that can actually do that as a consolidated piece of work.
But the machine will do it sooner rather than later. With radiology and histopathology.
Yes.
These are, I mean, even if you go to the radiology conferences now, in human medicine,
Yes.
how are we going to adapt to artificial intelligence? Because you don't need to sit, you already can read and report on your radiographs, MRI and CTs while you're in the hills somewhere.
Yes.
Or you can just have the machine do it, which is not the distant.
Yeah, or do both, and it depends where the AI is deployed at the time that the scan's acquired or at the time you're coming to report it. And if you're reporting it, so the example we use is there's an AI tool that will help you detect fractures in A&E. And often the junior doctor or the advanced nurse practitioner will see the patient, and they will be the first person to report that study. Typically, it then comes to someone like me, but I have a stack of almost 1,000 of those. It's going to take me 2 weeks to get there. So that tool will, in the interceding period, give them much more confidence about managing that patient. Not all AI is as advanced as that, and there's a lot of, I think, overstating about what AI can do, especially within imaging and especially within complex cases. Your routine things where we have large data sets to train this stuff on, yes. Rarer diseases are much more difficult. But that's where the scans are more interesting to report as well.
Well, and that's also where AI then comes to its own.
Good.
Because the routine stuff can be done by the machine, and where the machine is not good enough yet, is where this machine comes.
Exactly, exactly. And it's a bit like that slide we saw earlier about the phasing of AI, and that gradually it takes more and more of the human work. So, good. I think I'll hand over there, so I'm probably massively run over time.
Brilliant.
Thank you very much.
Thank you very much indeed. Yeah, thank you.